Hi everyone, my name is Raquel Forsgren. I'm the founder and CEO of Living Yoga Therapy based here in Chicago. And I've spent the weekend at the American Brain Tumor Association meeting here in Chicago, where there have been some amazing world-renowned neuro-oncologists like Mark Gilbert, Tara Armstrong, and Dr. Durham, just to name a few. And we spent a lot of time talking here at the meeting about the importance of what to do when you get an actual diagnosis with a brain tumor. And whether that brain tumor is benign or whether it's malignant, the strategies are still the same. And there were 6 things that they went over, and I'm going to try to distill it down because there was a whole morning session based on this. And the first thing is pick your team, and pick your team wisely, because ultimately they're going to help you make a decision that's going to change the trajectory of your life. So pick it wisely. Your neuro-oncologist is going to be your quarterback, so to speak. And it's really important that if you don't feel comfortable with your oncologist, or you ask your oncologist if they've treated a lot of brain tumors or things like that, and the answer is no, or you're just simply not feeling comfortable with that oncologist, you need to get a second opinion. It's very, very important. And I know people that I work with, and what I've heard for many years is a lot of times people are afraid they're going to make their oncologist mad if they ask for a second opinion. And what was very crystal clear in this meeting was, if your oncologist gets mad that you get a second opinion, you need to immediately change doctors. And that came straight from the oncologist at the session. So that's really, really important. The third is really prepare. Prepare for your meetings with your doctor, with your healthcare team. They do have a limited amount of time, and they want to give you the best answers they can, but if you're not prepared with your questions, your symptoms, it's going to be really tough to maximize the time that you have together. So come prepared with a list of your symptoms, a list of your questions and concerns, things that are keeping you up at night. Talk to your oncologist about it, talk to your nurse about it, but communicate. And that was definitely a key concept that came out of it. The other thing is identify a champion. Identify someone that can be at your oncology appointments with you or help you just make sense of what the doctor is saying. And what came up today is not going to be shocking to any of you, but when you're hit with a diagnosis, there have been studies that have been done that show the mind just completely going blank, and which makes complete sense if you really think about it. And so in those moments, having someone with you that can help you take notes. We even talked about the fact that just turn on your smartphone with a video. Obviously ask your healthcare provider if you can do that first, but record it, record the conversation so that you can go home and listen to it with a little bit more clear and calm mind. So that was a key point. The other thing is asking your oncologist what to expect when results come back. And scans came up a lot, particularly scans after you've just had radiation therapy. And the fact that sometimes these scans will actually show results that may make it look like the tumor isn't gone or the tumor didn't shrink. And part of that is just the results of what's happening from the radiation in your brain. So ask the oncologist to go over what they're expecting to see from your scans, and that's a key thing. And then lastly, just think about planning and even end of life, and that can be really obviously scary. And it's not that the oncologists want to be less positive about your outcome or any of those things. It's about relieving the stress of thinking through all of the other things, and the financial, the insurances, your will, all those things are really, really important. And taking care of those things early on can also bring a sense of relief and the feeling of control, because there are so few things that you have control over once you have a diagnosis. And what I'd like to add just as a yoga therapist is I'll be adding some videos onto my YouTube channel and onto my website, and with organizations like ABTA and Patient Power, where you'll be able to access those if you or a loved one are diagnosed and you cannot seem to calm your mind. Those videos and those meditations are going to help you because they're designed to help you just absorb what you just heard. So stay tuned for more, and I'll be bringing to you a couple of videos with a person that I met at the meeting, and he's a really awesome guy, and I can't wait to do some yoga therapy with him. He's really super inspirational, but I'll save all of that for the next one. Have a great day, and remember, knowledge is power. Stay informed and take control of what you can.